Hello, everyone. Welcome back to your anatomy lecture. Today, we're going to be continuing our discussion of the blood vessels of the upper extremity by finishing off by looking at veins. So we'll look at veins and then we'll look at some blood flow to see kind of how we can follow it. But let's go ahead and talk about veins. So veins, if you recall, these are going to be blood vessels that bring blood back to the heart. So we're actually going to be starting out small, and then we're going to converge to become bigger and bigger and bigger. So we're going to go from like the fingers and the hands, and then we're going to go up the forearm, across the elbow, up the arm, across the shoulder, and then back finally into the thorax, where we go into what's called the subclavian veins. So we're going to go up the forearm, or we're going to go up the upper extremity, back to the thorax, and back to the heart. Now, very briefly, you can see you have a bunch of veins, but the thing about veins is that there are some overlapping veins, as in like there's kind of two layers to veins. There are superficial veins, which you can see here, and then you have the deep veins, which you can see underneath. So these two veins almost run parallel to each other, but there will be some differences. But there'll be a set of deep and a set of superficial, which make it a little confusing at first. But just to be clear, I mean, think about the veins that you think you're going to be able to see most clearly. Those are going to be the superficial veins, while the deep veins are largely going to be following the arteries. So to go ahead and take a look at this, let's get started by just going over a brief overview of some of these veins. So I won't go over all of them, but if you look at the upper extremity here, you can see that you have two colors of veins here. So it's all blue, but some of these veins, if you look on the kind of far sides and on top of the bones, those are the superficial veins. So the superficial veins are the darker ones, and I think it's trying to indicate that it's easier to see. But if you look behind the superficial ones, you have the deep ones, which are a bit lighter in color, which are slightly opaque. So the superficial veins, you can see that you have these two long veins that are going to be on either side, and that's attached to something called the dorsal venous network on the back of the hand. These two veins are going to be bringing blood up all the way from the hand, through the forearm, through the elbow, through the arm, and then up into the shoulder, but in slightly different places. So to continue that discussion, let's look at the deep veins as well, which will be slightly differently organized. So we do start off with a medial and a lateral vein again, and these veins luckily will follow the arteries and will be very similarly named. So if you remember from before, you have a radial and an ulnar artery. These are where you have radial and ulnar vein. So you have radial and ulnar vein, and then furthermore, what do radial and ulnar artery come off of? So if you follow radial and ulnar vein, so if you look at these light colored ones back here, these will go up and join together. When they join together, they mimic the artery where you have the artery of the arm, and in this case, the vein of the arm, which is called brachial vein. Now, brachial vein is actually going to join with one of those superficial veins, and that is this long medial one called the basilic vein. And if you follow basilic vein up, brachial vein and basilic vein join together, and instead of branching, veins join to form new veins. So this vein right here is called axillary vein. So axillary vein is where you'll find brachial and basilic vein joined together. But if you follow axillary vein and continue it up, right before it goes under the clavicle to form subclavian vein, that cephalic vein that started all the way down here, goes up the forearm, up the elbow, up the arm. This is going to go into a very particular place between deltoid and pectoralis major, but ultimately join with the axillary vein right near the end of it. So at first, these veins are a little tricky, but if you can differentiate between the layers, it's not too bad. I mean, the ones that go with the arteries are usually pretty simple, but if you can remember those superficial ones, which there's only a few, we can definitely still keep things well organized. So there are a couple that I didn't go over, but let's go ahead and get into that. So first of all, when I talk about the deep veins, there's a term that I want to bring up, which is called vena comitans. So vena comitans are basically veins that go along with the arteries, and these will typically be a pair of small veins that just run along with the artery. And that's exactly what you'll see for a lot of our deep veins. So when we have like veins following the arteries, well, sorry, one last thing about veins. If you don't know about veins, when they go back to the heart, they actually don't have a lot of blood pressure, as in, like, they don't have as much of the force that comes from the heart, like being squeezed or with the blood being squeezed out, that the arteries would typically have. But veins, they rely on different things. Some veins require valves, some veins, and most veins actually require skeletal muscles. But in this case, the vena comitans, these veins are actually going to help or rely on the arteries a little bit. As in, like, every time the arteries have blood being kind of pulsed through them, that's going to help with squeezing the veins a little bit by pushing on them against other tissues and cause the blood to go back up at least a little bit more. So these veins are going to be very small, and on the cadaver, like, some of them actually won't be very visible, but at the very least, we can see them in this picture where we have these kind of two kind of intertwining veins that kind of look like they're twisting together a little bit. You have two veins in the forearm, which will be the deep veins, radial and ulnar veins. And once again, those travel with radial and ulnar arteries. But as the radial and ulnar veins join together, they're then going to form the brachial vein up here, which is our last major deep vein of the arm. So these, once again, are deep veins. So these will typically not be seen very well from the superficial or the skin. So in this case, these are going to be following the arteries, though. So radial and ulnar vein in the forearm, they join together to form brachial vein. But you also have superficial veins, and those veins are a little bit more different, I guess. So these veins, we haven't really used terms like this as much, but the first of which, this one actually does make a little bit sense, but what we have here is something called the dorsal venous network. So the dorsal venous network, if you look closely, you have a lot of veins that are kind of interconnecting, coming from the fingers or the digits, or coming from the metacarpals of the hand. All of these veins kind of interconnect, and in a little bit of an irregular way to some extent, but in general, they all kind of ultimately come to this larger area where you have this connection between these two superficial veins, the basilic and the cephalic vein. So you have a dorsal venous network, which will be a little bit variable from person to person, but it is going to be able to connect to the cephalic and the basilic vein to ultimately start to travel upwards, back the forearm and up the arm and so on. So we're starting here superficially, and if you look at the back of your hand, except mine, because I don't know, fat hands, but if you look closely, you'll be able to see that you might have some veins sticking out from the back of your hands. And if you do, nurses probably will love that, because then you'll be able to draw blood much more easily, or be able to put in IVs. So in this case, though, this is going to be the dorsal venous network. This is superficial and connected to the other superficial veins. So the superficial veins, before I guess we get to the big ones that travel upwards, there are a couple of smaller ones to bring up as well. So something I forgot to mention between cephalic and basilic vein is that there's actually something right in the front of the elbow. So if you're not familiar with the elbow region, the front of the elbow has a certain name, which is called the antecubital region. And the antecubital region is going to have a vein that travels across it, a relatively, well-known area where veins will be accessible, because this is where you will typically, at least often, draw blood from. So you'll see that you have this vein going along the front of the elbow. This is called the median cubital vein, and this is going to be connecting once again between cephalic and basilic. So this is a good area where blood could be drawn, and the median cubital vein being named for the cubital region in the front of the elbow. This is right in the middle of it. Median, middle, cubital, front of the elbow. But one more vein that you'll see running down from median cubital vein, although this is a little bit variable, you have a vein of the front of the forearm, which is called the median antebrachial vein. So while antecubital means front of the elbow and brachial means arm, antebrachial means forearm. So once again, median, middle, antebrachial forearm, going down the middle of the forearm, that's where you'll find the median antebrachial vein. So just to be clear, I mean, when you see it in a picture, that's great. And that's, what we usually will represent it as. But there are actually variations to this. So depending on, our individual cadaver donors, this actually can be a little different. So we'll be careful to look for this, but just to kind of go over at least two variations. If you look closely, the one that we just saw, sometimes the median cubital vein is actually kind of in a V shape, which has the median antebrachial vein running down from it. But sometimes it has, or the median cubital vein is kind of just going across, like in a diagonal line from cephalic to basilic. And then that median antebrachial vein actually comes off of the basilic vein. So, I mean, it's going to be variable. And in this last third one, you can even see median antebrachial vein coming out between that junction at median cubital and basilic. So, I mean, it'll be a little different between person to person. And similar to the dorsal venous network, there's a lot of variability. And something I forgot to bring up as well is that veins, especially the superficial veins, can actually change forms or get damaged even, like because of their superficial nature. And that will cause kind of irregular and different interconnections. And hopefully, no issues will arise from that. But I just want to kind of show you these different regions, or rather these different variations of this region. So let's go ahead and keep on going to talk about the basilic vein now. So the basilic vein, this is one of our major superficial veins. It starts at the dorsal venous network, but then it travels upwards, up the hand or up the forearm, up the elbow, up the arm, and then finally terminates when it joins with brachial vein near the axilla. So you can see basilic vein here. It travels along the medial side of the forearm, the medial side of the arm, and even has that median cubital vein connecting to it right over here. But you can see that it's superficial until it dives deeper into the forearm, deeper into the arm, specifically into the axilla to join with brachial vein. So it's a superficial vein until it needs to go deeper to connect to other veins. So the last superficial vein that we have here is called the cephalic vein. And if you look at the cephalic vein, it's on the lateral side. So cephalic vein, once again, starts at the dorsal venous network. It goes up the forearm, up the elbow, across the arm, but cephalic vein goes even higher than basilic vein as it goes up between deltoid and pectoralis major, right here in that deltopectoral groove. So this right here is where you find cephalic vein usually pretty clearly. And hopefully we were successfully able to find that on our cadaver donors, but you can see the cephalic vein is going to go up, but it is going to be slightly different from basilic vein in that it's not going to connect to axillary vein at the beginning. It's going to connect to axillary vein near the end. So that is one thing that is going to be kind of important about cephalic vein. It's going to connect to axillary vein at the end, right before it turns into subclavian vein. Now, once again, these are superficial veins, and just to demonstrate that ever so slightly, you can see these veins popping out. So I mean, if this were to be your desired effect, I mean, you can work out to the point where your blood vessels start to pop out. You become, well, for lack of a better term, vascular. And in this case, you can see some of our superficial veins like bulging out more. So if you look closely, this vein is traveling up the lateral side of the forearm. It goes up across the elbow, up the arm, and then between deltoid and pectoralis major. This is going to be your cephalic vein. Now, I've been talking about it a lot, but to talk about the axillary vein ever so, shortly, briefly, if you look at the basilic vein, it's going to go up and join with brachial vein. And this bad picture, but I'll show you it again in a sec. But basilic vein is going to join with brachial vein to form axillary vein, and then axillary vein will go up and continue. But as it does so, cephalic vein will then start to join with it, which kind of like the subclavian artery will transition from axillary vein to our last vein called subclavian vein near the clavicle or at the first rib. So right after the first rib, and generally when it goes under the clavicle, that's where subclavian vein will go up, or sorry, will start and then travel under the clavicle and travel more into the thorax towards the heart through something called the brachiocephalic vein. So as we'll see, that brachiocephalic vein will be formed by the juncture of subclavian vein, and then although we'll talk about this later, internal jugular vein. So to go back real quick, I do want to show you that one more time in a little bit of a better picture. So if you look closely, we have our superficial vein, or sorry, let's go with the deep veins first. So the deep veins, radial and ulnar vein. These two veins are the deep ones, which typically are paired. So this is a little bit of a simple picture because these are vena commutans. So vena commutans is usually a pair of small blood vessels that follow the arteries, but they will go up and join together to form the brachial vein. So basilic vein, or sorry, radial vein and ulnar vein join together to form brachial vein. Now look at this medial side of the forearm. This is where you have the basilic vein. It goes up and joins with brachial vein. And this is where you have axillary vein. But then cephalic vein goes up and does the same thing, but it does not join with brachial vein. It's going to join with axillary vein, but towards the end, and right after it passes the first rib, this is where it starts to turn into subclavian vein. So those are our major veins. We have one last slide that shows you them in the cross sections of the arm and forearm, but it's a little bit hard to tell what's what sometimes, but you can see at least some differences between the veins. You would be able to see the basilic vein kind of on the superficial aspects until it starts to go into the armpit region to become deeper. And then furthermore, you can see the cephalic vein running along the surface of the muscles as well. This is one of our superficial veins under the skin, so this is a vein that you'll be able to see potentially from the skin. And then you should also see the forearm with the radial and ulnar arteries, which will have the radial and ulnar veins as well. But once again, cephalic vein and basilic vein superficially under the skin, outside of the muscles, and potentially visible. Now, before we finish up, there's one more thing I want to kind of go over a little bit, which is something called a blood flow pathway. And I'm sure you've done something like this, which is just effectively a blood flow chart. But for blood vessels especially, it's helpful to see how things kind of interconnect, as in like what leads to what. So this kind of diagram is especially useful. So let's go ahead and try to do the veins, and then maybe we'll try to do the arteries a little bit as well. So let's go ahead and take a look at what we've got. So what we would like to do for veins is start at our smallest components. So since veins are deoxygenated blood, we typically start with the blue color. So if we look closely, these veins are going to travel back. So actually, I should probably start off with the words, but Get some letters in here. So deep veins. These will include your radial, and then also ulnar vein. But then you also have your superficial veins, which include iliac vein, technically also dorsal venous network, and then also celiac vein. So we kind of have to start at all of our smallest veins and then basically work backwards. So we are traveling back to the heart, so we should find these veins joining together. So basilic vein and radial vein go back, and then they are then also going to join together. So when these veins join together, they're going to form a new vein, and that vein is going to be at the arm region. So the word for arm, this is the brachial vein. Now brachial vein is going to go up, and this is going to join with another vein, but we have to talk about these other ones before we can do that. So actually, I would like to switch a couple of veins in their position real quick. Sorry if I'm your drawing, but it's better with basilic vein on this side because what we're going to find is that basilic vein goes all the way up here. So it goes up the forearm, across the elbow, up the arm, and then brachial vein is going to join with that. And this is where we're going to form a new vein. So this vein is going to be called, oh, this vein is going to be in the armpit region. So this is called axillary vein. Now, cephalic vein is going to do the same thing, except it's going to join with axillary vein at the very top, or towards the very end. So all the way from downtown, this is where you're going to have axillary vein continuing, but then this is where cephalic vein goes into it towards the end, but not at the very end. But this is also where axillary vein will turn into subclavian vein. And then if you'd like to, I also like to add in certain landmarks. So in this case, this landmark is going to tell me where it changes from subclavian or axillary to subclavian. And that case would be first rib / clavicle. Now there's a couple things that I missed here though. So number one, dorsal venous network is connected to both of these. So let's go back to our blue color. My menu is blocking it, so sorry for the asymmetry, but good enough. But then there's also a vein that's going to be going across the elbow, right over here, between cephalic and basilic. That vein that's across the elbow, the what region? Antecubital region. This is called median cubital vein. Be careful, median, because it's in the middle of the cubital region. But then also there's a vein that goes into this right here, or towards the end. It depends on, the person, but I'll just put it here just for simplicity's sake. That is going to be called median antebrachial. So not median cubital, but median antebrachial vein. And remember, brachial was arm, median antebrachial is going to be forearm. So this is as far as we've gone so far. But just to kind of give you a short spoiler, subclavian vein will continue and join with another vein, which is the internal jugular vein. And then when those join together, they're going to form another vein, which coming from the head and the arm. So what's the word for head? Oh, wrong order. What's the word for arm? Brachio. The word for head, cephalic vein. So this is how I used to study veins and arteries, to follow them, to see where they connect, when, or like how they're organized. And you can draw this in different ways. I draw it just in a general kind of like blood or flow chart type of manner, as in like this is not in the shape of a body at all, but some people do. And if you can do that, if you can organize in a way that's going to be clear, then I would highly suggest it. But this is at least something that I would try out and practice to see if you know how blood vessels will be connected to each other, because this is a great way to visualize it and organize the information that can be a little bit overwhelming at first. So if you're not as familiar with how blood vessels connect, like this is something that I can do to strategize how I would look at stuff. And then if I wanted to, I can even follow a vein all the way from, let's just say, the pinky. So from the superficial pinky, we go through the dorsal venous network, the cilic vein, axillary vein, subclavian vein, and then brachiocephalic vein to go back to the heart. So this should be something that would be pretty helpful, but we do have more blood vessels to go. So I actually have another thing, or another thing that I worked on a little earlier. So hopefully it'll make things a little bit quicker. So if you look closely, this is the arm. So you see some words that might look familiar? Brachial, radial, ulnar. This is the general organization of the arm. But there's a little bit more to this, as in like if we're gonna just follow blood flow down the arm, this is pretty close to where we're gonna get. In fact, let's just finish this off real quick by seeing that brachial is gonna, so first of all, you have brachial artery that goes down the arm. Brachial artery branches to radial and ulnar artery. Now, radial artery, well, actually, both of them are going to be continuing down into the hand. And this is where you'll have these two levels of blood vessels in the hand. So, radial artery has a deep ulnar branch. So does the ulnar side. And in a similar manner, it also has a superficial ulnar, oh, I ran out of space, branch. And then that's going to apply to the ulnar side as well. And then these are going to then go to two little arches, and I'm going to have to write over it, but the ulnar arch, people, and then superficial ulnar arch. So these are going to be the blood vessels that travel down the arm into the forearm and into the hand. Brachial artery branches to radial and ulnar artery. Both radial and ulnar artery will have deep palmar branches and superficial palmar branches, and those will go to the deep and palmar arches respectively. But the radial artery will also have palmar and palmar and dorsal carpal arteries as well. But that's going to make things a little bit, messy. But not to say we're not going to get messy. Let's take a look at some anastomoses. So the anastomoses, there are actually a few more arteries that come off stuff. Oh my God, I made a typo. But this is supposed to be radial. But let's go ahead and add to this. So the brachial artery. The brachial artery has a pretty significant branch that goes deeper into the arm. So if this is going deeper into the arm, what would this be? This is called the profunda brachii artery. The profunda brachii artery. And this is going to continue downwards. Why? And this is going to continue downwards to a couple more branches. So this continues down, but then has a couple branches coming off of it. Okay, let's just fix this now. So these two branches are going to be actually joining with a couple branches from the forearm. So one of which will be a little bit intuitive, which in that it is going to have something called the radial collateral artery. And then that's where you're going to have an artery coming off of the radial artery to connect to it. And if blood vessels go backwards, or if anything goes backwards, we have a term that we typically will use. It's called recurrent. So this is called the radial recurrent artery. What we'll see is that in a weird way, these blood vessels interconnect, and this is what we call an anastomosis. So this anastomosis, this is going to allow for this blood or this area to receive blood, even if one of them were to be slightly either impinged or blocked or broken even. So if the radial collateral artery gets broken, the radial recurrent artery will be able to bring this area of blood along the elbow. Or more often, if there were like, pressure that was put on the elbow in a certain way, then every time you move, you're going to be kind of squeezing certain blood vessels. So this helps to make sure that this part gets blood in general. But you also have one more artery over here called the middle collateral artery. And this is something that I want to talk about in just a minute because it's going to make this very confusing looking, but we have a couple more arteries as well coming off and connecting to the ulnar artery. So going off this way, let's see the best way to do this. So let's just go there, go here, and also there'll be a couple coming off of the ulnar artery as well, which will be connecting to them. So once again, you have collateral and then recurrent arteries. So these collateral arteries, there's two of them, one that's higher on the brachial artery, one that's lower. So these will be named inferior ulnar collateral artery, and then also superior ulnar lateral artery. Now, unfortunately, we can't do the same naming convention as what we do with these two. Instead, the ones that come off the ulnar artery are actually going to be called anterior and posterior. And it's a little bit tough to kind of figure out a way to remember which one's going to connect to what. But I like to remember that the two vowels and the two consonants will connect. So in this case, ulnar connects to anterior, which starts with a vowel. So anterior, ulnar, but since this is going backwards, kind of like the radial, this is called recurrent artery. And that means that this one down here, this one that starts with a consonant, is posterior ulnar collateral artery. Now these two, or these four, will also be forming an anastomosis, which is where they kind of connect and go to a common place or a common capillary bed. Now, one more that kind of makes this whole thing a little bit hard to visualize, but let me just change this color just a little bit, and hopefully you'll be able to see this a little better. But this is where we have something that goes back and connects to the profunda brachii artery. So this is going to be called the interosseous. There we go. The interosseous artery or interosseous recurrent artery. And this is going to be connecting to middle collateral artery. So interosseous recurrent artery. Will be connecting between them. So if you were to just follow the general blood flow, I mean, this blood flow pathway would be really simple. But if you add in like all the recurrent arteries, it does get a little tricky. But at the very least, this is how you can visualize it. This is how you can see which ones are connected, which ones linked to what, but also try to kind of like link the words radial and radial. These are the two that connect, the two vowels, the two consonants, and then these, I guess, middle. Middle is down the middle, and then interosseous. That's also in the middle between the bones. So there are a couple that I left off though, because once again, it's going to make this crazy looking, but ulnar artery has a couple of arteries that goes along the interosseous membrane as well, which will be, all right, fine, just add it. So if you want to stop now, this, I mean, I would not blame you, but coming off of the ulnar artery, this is where we're going to have the, so just to be clear, I'm actually not putting all these in order because it's getting a little bit hard to manage, but this is where you'll have the common interosseous artery. And then you'll have two branches that come off of this, which will be anterior and posterior interosseous artery. Whew. So we kind of made a little mess, but still, I mean, this is how you would be able to visualize it. If you wanted to keep it simple at first, feel free to do that. And if you want to make like maybe a separate one to look at all the anastomoses, that would be a good idea as well. But you can see that it does get a little bit in depth, which is why it's all more important to look at these very carefully and hopefully organize them using whatever tool you like. But this is the way that I used to do stuff, just to visualize and to diagram and to organize it. Now, lastly, I already finished this other one, but let's go ahead and take a look at one more, which I'm just going to bring up and let you kind of copy down if you'd like. But this one is a lot more full, I guess. But there are branches that come off along the way. So it's not to necessarily that they're going to like just branch and go to a lot of different smaller things. This is just following the large branches of the subclavian artery. So forgot. Subclavian artery is actually three parts, first, second, and third. And this is relative to the anterior scalene, but you can see that you have vertebral artery, which is going to go to the brain, internal thoracic artery that goes along the back of the sternum, and then thyrocervical trunk, which has one branch that we want to know about, which is suprascapular artery. So suprascapular artery, this is going to go along the top of the scapula, which makes sense coming off of the top of the subclavian artery. But then you also have two more arteries over here, costocervical artery, which is going to be going along like the ribs and the neck, and then dorsal scapular artery. This is going to go along the back of the scapula, or rather the medial side of the scapula. And then we switch to axillary artery, which is where we have the first, second, and third part, which is relative to the pectoralis minor. So if it's above pectoralis minor is the first part, if it's under pectoralis minor is the second, and if it's, like deep to pectoralis minor is the second, and if it's inferior to pectoralis minor is the third part. So once again, you have some branches. Thoracoacromial artery, this kind of goes upwards towards the acromion. Superior thoracic artery goes along like the top of the thorax. Lateral thoracic artery goes along the side of the thorax. And then down here, we should have some arteries that look familiar. So the anterior and posterior circumflex humeral arteries. Those are the ones that are going along the neck of the humerus. And then you also have the subscapular artery that's going to go under the scapula. So if you'd like to, go ahead and try and copy this and draw it down, or draw it as well. But if you need to, just pause the video and do that instead. But I think with that said, that should be just about it. So this is going to be the lecture for the blood vessels. I mean, all of these blood flow pathways were technically supplemental, so if you don't want to go over that part, well, I guess you already did, but I think with that said, that's it. So thanks for listening. Good luck with your studying, and I'll see you all next time.